Hello and welcome to the Physio channel. We've got Richard here with us today who's presented with some shin pain. Now shin pain could be caused by one of three things. It could be anterior compartment syndrome, which is pain and swelling on the outer shin caused by the tibialis anterior muscle becoming inflamed in its compartment. Or it could be a stress fracture or bone stress on the inner shin here, the lower part of the tibia, and this would usually be characterized by more focused pain and pain at night or pain with simple things like walking. What I think Richard has though from discussing things with him is medial tibial stress syndrome, MTSS. And this is often characterized by more diffuse pain on the inner part of the tibia, inner part of that lower shin bone there, usually spreading by about 3 or 4 finger widths in terms of the pain diffusion in that area. So that's what I think he has in this case. And we're going to go and have a look now at what we can do to help him. One key point to remember here is when something gets called a syndrome, it usually means that medical scientists haven't been able to determine exactly what it is, and it usually relates to a pattern of symptoms. So what we're likely dealing with here is soft tissue pulling on the bone in this region. If you're a medical person, then it's postulated that we're dealing with fascial traction on the periosteum. It's probably related to intense training or new training without adequate time to rest. So let's ask Richard a few questions to see if we can determine what the cause might be. So Rich, I know you've just started running. Can you please tell me a bit about your training program?
Sure. So I started off running every other day. I find I really enjoy it. It makes me feel good. So I've been running every day now.
Okay.
And then on the weekends, I've got a lot more time. So I go for some really long runs.
On both days at the weekends?
Oh yeah, both days.
Right. I think we might have identified part of or the problem. So Rich, the first thing I want you to do is to have a look at this chart here and to follow it. This relates to stress fractures rather than what we think you've got, the stress syndrome. But it's very sensible advice that can apply to you as well. When it says rest here, this can be non-weight bearing activities, just as long as it doesn't aggravate your symptoms. So it doesn't mean you have to sit down in a chair or lie on the couch. You can definitely be active, just as long as those activities don't aggravate your symptoms. So it could be something like cycling, swimming, or on the rowing machine, for example. Stay tuned while we show Richard 3 treatments to help reduce his pain. Please hit the like button if you're finding this video helpful, and in the comments below, let us know which of these following 3 treatments you found the most helpful. Firstly, we're going to do some hands-on massage, and these are my 3 favorite techniques for medial tibial stress syndrome. The first one is just some gentle soft tissue mobilization where we start with the hands behind the calf muscle on the lower half and bring the soft tissue forwards, particularly paying attention to the inside where we're rolling that soft tissue forwards towards the tibia. And before I started this, I put a little bit of oil onto the skin. That's not necessary for this technique, because I'm locking into the skin and pulling the soft tissue forwards, but it'll become more useful as I show you the next 2 techniques. The next technique is a bit more specific. I'm going to hook the end of my fingers and come in just behind the tibia there, and then I'm going to provide some counter pressure on the outside with my other hand. So most of the focus pressure is on the inside, hooked behind the tibia, and I'm going to come down and definitely want some oil on the skin for this so that you can slide down, right down to the lower tibia, dropping behind that medial malleoli ankle bone just here. The third technique is the most intense. For this one, we come down to that painful region. Once again, we lock in behind the tibia there, pressing in with our fingertips, right over the painful area to the patient's tolerance. So keep an eye on your patient's facial expressions. If they look, or if you're doing this to your friend or family or even on yourself, if you have a facial expression like this, then that's not so good. It's probably causing far too much discomfort. But a facial expression like this indicates you're probably using the right amount of pressure. So you can sustain the pressure until the pain starts to reduce and the sensitivity of that area has reduced. Or you can add in a little bit of soft tissue mobilization as well. One of my favorites for this area is to use cupping, in particular glide cupping. So the cup is attached and then glides across the soft tissue. And this can feel quite nice because it pulls on the soft tissue and often creates a nice releasing feeling as it's pulling and decompressing rather than the compression that we were doing with our fingers. We can also use the rock blade to do some instrument assisted work over this area. And if I just lightly rub repetitively over this area, this is called feathering. This can lead to some temporary pain relief over this region. We can use it in a bit more of a focused way with some more pressure, and once again come down the back of that tibia, that shin bone, as we were doing with our fingers, but this is another way, and perhaps a way which helps reduce fatigue in your hands, especially if you're doing a lot of hands-on work. For this next technique, we're going to look to reduce the symptoms by using some tape. We've got some RockTape here to bring that soft tissue from behind the tibia and pull it towards the tibia. Remember, we said in the earlier part of the video that the problem can be caused by soft tissue being pulled away from the bone, or the fascia being tractioned on the periosteum. Or what we can do here is try and reverse that by approximating the soft tissue towards the tibia. So come and have a closer look and I'll show you how to do that with one simple piece of tape. So here is the painful area. Remember, we said it's a diffuse area on the inner part of the tibia, and it's thought that the pain is caused by the soft tissue tractioning on the bone. So therefore, if we use our tape, let me draw an arrow on there. If we use our tape to draw the soft tissue towards the bone, then that should, and in most cases often does, significantly reduce the symptoms. So I've got a piece of tape here that I've cut and measured to go from around the back of that area up over the front of the shin, and it's also going to go upwards at that oblique angle as well, because I find that helps to reduce the symptoms just a little bit better than coming straight across like so. So we'll just tear the backing paper. One thing we've done, which we haven't shown you on the video, is clear off the oil that we had on the leg there from the massage. It's really important that you clear off any oil or wax, otherwise your tape won't stick. So let's get the tape stuck around the back there. And even though Richard's got some hairs on his legs here, the tape has stuck quite nicely, no problem whatsoever. Then with this hand, I'm going to approximate that soft tissue and pull it towards the front of the shin, like we did with the massage technique. And then with this hand, I'm going to pull that tape tight up over the front of the shin, and then I'm going to let go with this hand and stick the tape down on the outside of the leg. So there we go, let's just have a closer look. So we started the tape around the back of the leg there, you can just about see that on the camera, and then it went up and around with some tension over the front of the shin, and then no tension on the last bit of the tape on the outside of the leg, like so. So that is the shin taping for medial tibial stress syndrome. I'll put a link on the screen just above here to also show you another video where you can do this but in a more comprehensive way, and actually include another piece of tape which comes down over the foot just here. And that can actually be a little bit better, although it is a bit more complicated to do. So this next technique involves stabilizing the foot. When we walk or run, the foot naturally flattens, and this long arch of the foot here naturally flattens down in order to absorb forces from the ground, whether you're barefoot or wearing trainers. So what we can do to try and reduce that is use an orthotic like so. And now when Richard places his foot on the orthotic, it has some supportive material on the inner side of the foot there, on the arch, on the inside of the heel, and that helps to prevent the foot from excessively rolling inwards, from excessively pronating, and this can help to reduce symptoms because that excessive pronation, if it's uncontrolled or the individual's not very well physically conditioned or is just suffering from fatigue from excessive or new training, can cause stress in the lower limb. And of course we're dealing here with medial tibial stress syndrome. So to try and reduce that stress, adding in an orthotic can be helpful and can reduce symptoms. Now, I would suggest just using an orthotic in the short term to reduce symptoms, and in the longer term, working on the natural strength of the limb and in particular of the lower limb, so that the person does not have to rely on the orthotic. Okay guys, that brings us to the end of this video. I hope you found it helpful and have put a comment below to let us know which of the techniques you have found or find the most helpful. And please like to help increase the visibility of this video on the YouTube algorithm. So we're going to say goodbye to Richard now. There he goes. And next, when Richard comes to see us, we're going to go through some running techniques to help you run injury-free. We'll put those up on the screen for you to have a look at just here. Thanks for watching. We'll see you in the next video.